When patients come in and they say they have TMJ, or somebody told them they had TMJ, or their doctor recommended they see a dentist because they suspect TMJ, I always try to find out, well, what was the diagnosis? Because TMJ, unfortunately, I mean, not to be sarcastic or anything, that's kind of like saying, oh, well, you have a knee. Okay, well, yeah, I have a knee. Is there something wrong with the TMJ? And if there is something wrong with the TMJ, what is it? Is there arthritis in the joints? Meaning, are the bones actually wearing down? Is the soft tissue in the wrong way? Because the TMJ, the joint itself, is different than all the other joints in the body. It's more complex because it doesn't just rotate like my arm here and my elbow, but it actually slides back and forth as it rotates. So there's a lot more parts to it. A lot of times people can have pain in their jaw and it's not related to the joint itself. Maybe it's a muscle or an imbalance with the patient's bite. So we want to determine that, because if it's the teeth that are causing the jaw problem, then the teeth need to be fixed. If it's the jaw that's then causing teeth problems, then we need to look at the teeth and fix that. And there's a lot of ways. A lot of patients have been told, oh, well, the only way to fix TMJ is surgery. That's not the case. There's a lot of ways to fix it non-surgically, and in fact, that's the preferred method nowadays. Most oral surgeons and general surgeons don't want to do TMJ surgery because it might be a temporary fix, but the problem doesn't go away and it just gets worse, but now the person has less range of motion and has other complications from it. So if we can fix that and get a proper diagnosis, that's the key to fixing the individual and getting them healthy. TMJ can be scary for patients too, because I've had a number of patients who come in and they're frightened because they'll come in on emergency basis because either they've yawned real big and gotten their mouth stuck open and they can't close, which is frightening because you're stuck there, your finger closed, or they can't open beyond one finger and they can't get anything in there. And that can be really scary for somebody because they're stuck or they have something called lockjaw. That again is something that's not normal. And if that happens to people, a lot of times they can unlock themselves after a period of time. But if that continues to happen, it starts to break down the ligaments and the bones and the supporting structures. And that can be really detrimental. So our therapy, my primary way of fix people is non-surgical. We're able to go ahead and balance the joints and get them healthy by putting splints in their mouth, adjusting them, and orthopedically repositioning the bite to allow everything to heal normally. And that's the best way to do it, in my opinion.